Big idea number 2, dopamine overload. This fine-tuned balance of ours has evolved over millions of years to help us approach pleasure and avoid pain. It's what's kept us alive in a world of scarcity and ever-present danger. But here's the problem. We no longer live in that world. We now live in a world of overwhelming abundance. The access, quantity, variety, and potency of highly reinforcing drugs and behaviors has never been greater, including drugs that didn't exist before: texting, tweeting, gaming, gambling, sugar shopping, vaping, voyeuring. The list is endless. Online products, with their flashing lights, celebratory sounds, laudatory likes, bottomless bowls, and the promise of ever greater rewards just a finger click away, are engineered to be addictive. The smartphone is the equivalent of the hypodermic syringe, delivering digital dopamine for a wired generation. If you haven't met your drug of choice yet, it's coming soon to a website near you. Yet despite increased access to all these feel-good drugs, or as I hypothesize, because of it, we're more miserable than ever. Rates of depression, anxiety, physical pain, and suicide are increasing all over the world, especially in rich nations. Our compulsive overconsumption has led not just to increased psychological suffering, we are literally consuming ourselves to death. 70% of world global deaths are attributable to diseases caused by modifiable behavioral risk factors like smoking, physical inactivity, and diet. The leading global risks for mortality are high blood pressure, tobacco use, high blood sugar, physical inactivity, and obesity. In 2013, an estimated 2.1 billion adults were overweight, compared with 857 million in 1980. There are now more people worldwide who are obese than who are underweight, except in parts of sub-Saharan Africa and Asia. The poor and undereducated, especially those living in rich nations, are most susceptible to the problem of compulsive overconsumption. They have easy access to high-reward, high-potency, high-novelty drugs, at the same time that they lack access to meaningful work, safe housing, quality education, affordable health care, and race and class equity before the law. This creates a dangerous nexus of addiction risk. Over the course of my 20-year career, I have seen more and more patients, including otherwise healthy young people with loving families, elite education, and relative wealth, presenting with depression, anxiety, and/or full body pain in the absence of any identifiable disease or tissue injury.